The Virginia Department of Health putting out an alert about possible measles exposure for passengers who may have been at Dulles and Reagan airports last week. Fox 5 David Kaplan is live at DCA for us tonight. And now this is a serious warning, David. What's the very latest?
Yes, Sierra, good evening to you. The Virginia Department of Health just put this notification out earlier today saying that a passenger who had traveled internationally and had gotten back to Dulles Airport and eventually left the D.C. area from Reagan Airport did, in fact, have the measles. The Virginia Department of Health saying they are putting this word out here out of an abundance of caution. So take a look at your screen right now. We've got the times and dates that the health department is notifying people about. The passenger was inside the International Arrivals Terminal of Dulles Airport on Wednesday, January 3rd, 10 days ago, between 4 and 8 p.m. and inside the A terminal here at DCA in between 2:30 and 6:30 on January 4th. They're asking anyone who might have been here at those times to monitor themselves closely for symptoms. A health department official I spoke with said that passengers who may have been in those airports around those times should closely monitor their symptoms until January 25th. Okay, so what's with the measles here? Well, we've got some depth and context about it all. A health department official and another infectious disease expert I talked to said that international travel, which has increased since the COVID-19 pandemic ended, well, that's a key source of it. Typically, someone who's not vaccinated travels to a part of the world where the measles is much more prevalent than the United States, gets it, then returns home. Fox 5 spoke with infectious disease expert Amish Adalja, who reiterates a measles vaccination for you and your child integral to maintaining large immunity here in the United States.
So I really think it's important that if your child is not vaccinated against measles, you get them vaccinated against measles. If you're an adult who has avoided measles vaccination, you should think about getting measles vaccinated now, because this is still a threat. And when you have an exposure, when you have an outbreak in a given city, it's very disruptive. Measles is a very contagious disease, and there are a lot of resources that are put in place to try and stop a measles outbreak from occurring. And this can all be avoided. It's all really preventable if more people were vaccinated.
As a matter of fact, measles widely regarded as the most dangerous yet preventable disease by getting vaccinated. Sierra, those most at risk, those under 1 who have likely not gotten their measles vaccine yet, or anybody who is unvaccinated. So certainly the health department trying to get people to pay attention to their symptoms if they were in the airport, either of those airports, around those times.
Exactly. Important to get the word out about this. Now, David, did you get any other insights beyond international travel for why we're hearing about more instances of measles across the entire country?
Well, Sierra, that's definitely a big one, is international travel. Aside from that, Amish Adalja says that a lot of families kind of got off schedule during the COVID-19 pandemic with childhood vaccinations. So he encourages people, if you did not get your child vaccinated, to be sure to do that for the measles. The other thing that Adalja pointed to was the fact that vaccine hesitancy has definitely become more prevalent. U.S. health officials reported last year that 3% of all kindergarteners, their families, opted their child out of getting a vaccination. While that number, 3%, seems low, it does, Sierra, mark one of the highest numbers they've ever seen.
David Kaplan for us tonight. Thank you.